Welcome to Why I Research, the podcast designed to recognise the brilliant faces behind some of the new and cutting-edge health research coming out of Newcastle University. Each episode we'll chat to a different researcher to spotlight the people behind the science. My name is Charlie and this is Why I Research. Today on the podcast we have the brilliant Claire Smiles. Claire is a PhD student at Newcastle University who does some really fantastic work looking at reproductive health and social care needs of women who use drugs. We talked to Claire about the pride her family had for her science journey and the passion she has for her work and the women that she works with. Welcome to the podcast.
Hello.
Thank you so much for joining us today. I'm very excited to have a conversation with you. To kick us off, do you want to give us a little bit of an introduction as to who you are, what you're all about, something exciting?
I'm Claire Smiles. I'm a third year PhD student at the Population Health Science Institute. My supervisory team are the fabulous Ruth McGovern, Eileen Kaner.
Gotta get that in.
And Judith Rankin. No, they are fabulous. And my funder is Fuse. About me, aside from being a researcher, I'm a mum of one and a boxer dog lover.
Oh, excellent.
Is that all right?
Love it. Yeah, perfect. That's absolutely fine. How does it feel, third year of PhD? Because that's kind of coming towards the end of the PhD now, isn't it?
Yeah. I think because of the last 2 years, if I'm really honest, it's a little bit of a blur. And I'm a little bit of a kind of get on with it person and don't kind of, I don't know, I don't freak out about kind of, you know, we're getting to the end and all the pressure. I think
that's the mindset you need to have as a researcher.
I think it's something that I've learned over time. So we'll see how that develops.
How long that sticks as you get
how
closer
long
to
this
the
calmness kind of continues. But it's obviously daunting, but I think I'm an optimistic person as well. I'm focused and I'm sure I'll get there in the end.
Oh, definitely, definitely. It's just a daunting time, isn't it? Well, third year of PhD, so that's where you are now. But I wanted to know a little bit about how you got from A to B and how you got to being in this position, doing your own research, doing your PhD in public health. So was there anything when you were younger that has kind of like been something that's inspired you to kind of go down this route into public health and doing this work that kind of supports other people?
I guess if we want to go kind of back to the kind of earlier years, I suppose my mum and my aunties were all involved in the homeless sector for many, many years, and that was in Dublin. They were always frontline workers within organisations and kind of running organisations, and one of my aunties was a social worker. So I suppose without actually really knowing or acknowledging that, it was just something that was within my kind of, you know, my family, and that was their jobs. And that kind of maybe shaped unconsciously, I would say, how I kind of ended up with an interest in public health and particularly vulnerable populations. I did my undergraduate, so I finished school. In Ireland, it's a little bit more long-winded than here. You do 7 or more. What you would be A-levels, we do Leaving Cert. Right. So it's just, I suppose, a little bit different. And then when I finished, I went to university, but I didn't do university in Dublin. I wanted a new experience. So that was brilliant for me because I grew up in a really working class area in Dublin, and this was all new to me to kind of step outside that kind of, you know, like, well, home and, you know, that outside community. That bubble. Yeah, it is a bubble. It is a bubble being within your community. And I was really well known within my community as well. Like I had like lots of peers and all my family live in the same area, you know. So I stepped outside and did my undergrad. I was the first person in my family, not only my kind of, you know, my mum and but like their families as well. So nobody'd ever gone to university. So I think there was a lot of pride there that I'd kind of dared to dream and kind of wanted to go forward with education. So I spent 3 years doing my undergrad, and that was in geography and anthropology. So not really public health, but I actually don't really remember public health programmes there.
Well, it's a really specific thing, isn't it? Yeah. I mean, it's not, I think it's because the anthropology and stuff is very much around kind of like people, and I suppose it just like narrows and narrows. Where did you do your undergrad?
So it was, at the time it was called National University of Ireland, Maynooth. I think they've changed recently.
That's quite a lengthy name.
Yeah, NUIM. I think they've changed now just to be Maynooth University. I loved it. I absolutely, like, I moved out of home and I lived there Monday to Friday and then worked at weekends. I, like, so enjoyed the culture. I enjoyed the classes. I had some really, like, inspiring lecturers that were there, and, you know, it really, really appealed to me. So when I was finishing up there, I actually did my my anthropology thesis on homeless women's pathways through services and how they kind of navigate that and how it was a revolving door, and that was ethnographics. That was my first taste of research.
So when you say homeless women's pathways, is that pathways through, like, support networks?
Yeah, like what was created or in place already and how they were supposed to kind of navigate these in a kind of really vulnerable position, particularly when a lot of them had caring responsibilities and other kind of health impairment, drug use, alcohol use, and it was all about that, and I really, really enjoyed it, and that was my first real taste of research, and it was a great opportunity that I think I went out and did it. I did a real piece of research. And then when I finished up there, because I had a brilliant lecturer in geography that I really, really liked. He was really passionate, enthusiastic. I really enjoyed his class as well. I actually went to London then just to kind of further the distance then and move out of, like, and for another experience, and did a master's at King's College London in geopolitics, territory and security. And again...
So was that your first experience of London then?
Oh, yeah, I moved over, didn't know anybody.
So what was that like? Because I was from a similar experience in that I came from a very working class background. I remember setting foot on university campus and being like, this is wild. And the first time I went to London absolutely terrified me because it was just crazy to me. I
absolutely loved it. And I just settled it. I can't say I settled in because I don't think you ever settle into London because it's so fast paced, and, you know, although I live, like, really close to Dublin city centre, like, it's nothing like London. I just hit the ground with my feet running. I went and got a part-time job straight away. My university was across, like, the bridge, and I integrated really well with everybody in my class. And in hindsight, I think I recently I've been doing a lot of, like, you know, thinking back and like reflecting on a situation. A lot of like, it was King's College, so it was what was perceived to be a brilliant university. Yeah. Certainly, like, my mum and dad, I'll never forget their pride when I got into King's College London. They couldn't tell enough people. But everybody in my class was really wealthy, and I was the only one that had a part-time job. So that maybe was a new experience because that wasn't what I'd had kind of in Maynooth. It was I got on really well with everybody. I integrated really well, and I lived there for after my master's finished. I lived there for quite a long time afterwards. So I really
so you really liked London then?
I really liked London. I really like London. I still love London. And when I finished up, funnily enough, there was, like, seminars and, you know, lectures and stuff like that and assignments, and I still deviated. Even though I was doing a master's on geopolitics, the focus was around public health, or, like, I still managed to kind of twist assignments into kind of within the public health spectrum. So that's interesting. And as I said, I lived there. I went on and I worked for a global drug survey, which is they do a massive survey of drug users. So that was, like, a fab opportunity. And I think Adam,
so was that after your master's?
After my master's, and Adam, who is the kind of, Dr. Adam Winstock is the kind of director of GDS, has been kind of a mentor throughout my career, having met him. So that was a fab opportunity. And again, it was research. We were looking at, it was more quantitative research, and I'm a qualitative researcher now. But it was interesting because it was looking at kind of recreational drug use across the globe. And, you know, it was like a self-selecting survey that we did. And I was with that from the very beginning for about 8 years. So I was kind of a part of it in some way or another for a long period of time, but from the very kind of beginning. So that was lovely to watch that grow. And then I went and worked in practice. I feel like I may be going on a bit of a long-winded tangent here.
No.
Then I worked in practice, so kind of wanted to maybe go into more of a practice role. So then I went and worked in drug and alcohol treatment services in London. I did a couple of them. across different boroughs. So then I got to see both sides. So I got to see kind of recreational drug users who were having lots of fun. Sometimes they were getting in risky situations, but we got to kind of map the growth of like emerging trends like methadone and ketamine were being used. And then we had people coming with ketamine bladder, and all these things were coming out in Global Drug Survey. And then when I was working in practice, I was seeing the other spectrum of things where people were, really, the harms of drug and alcohol were really apparent. People were really, really vulnerable. So I kind of got to see two sides or different facets.
That's really interesting because there's a lot of that in science. I think that there's almost like a separation of like the research that you're doing and the people that you're actually impacting with it, and to be able to see that from both sides of like the quantitative stuff that's coming through in a survey and having that knowledge, but actually being able to see, well, this is how it's impacting people on the front line. This is what it's like for people in day-to-day experience. Yeah.
And I think it kind of showed me that it's not linear, because I suppose the pathways and the kind of things that are in place, it looks like a bit of a linear thing of dependency and stuff like that. But I got to see people that, were reporting having fun times and social kind of positive experiences while using different type of drugs, and managing their own risk really well around their dosing. And then I also got to see situations that were, if I'm really honest with you, tragic, full of trauma. It kind of made me look at a bigger picture than just having experience with one.
It's that lived experience has got to be a lot more complex than what people without that experience might think on just a surface level of what drug and alcohol use is.
Yeah, and I think there is a bit of a binary about that, or certainly there was in like drug strategies or kind of messages around harms with drugs. If you use drugs, you will die, or if you use a certain drug one time, you will be addicted. And I think I got to kind of a bigger perspective on things by having both of them. And, I enjoyed working on both. And sometimes they overlapped as well, where I was doing a little bit of work for Global, but I was still working out in like kind of as a practitioner. And then, I think I came to the Northeast years ago now. Maybe 6 years ago, somewhere around that. Don't take my word for it. That might not be true, but somewhere around that time, I came to the Northeast.
So what pushed the move from London up to the Northeast?
I had a young son, and the expense, if I'm really honest, of London and no family support around. And I suppose, I was happy to kind of make a change. I just wanted a different environment for him to grow up in. And the Northeast is a lovely place to do that.
How's the Northeast been treating you over the last 6 years?
I love the Northeast. I love the people. I think there's a real synergy between like Irish people and Northeast.
That's so interesting that you say that, because we had someone on the podcast yesterday who said the exact same thing. That there's similarity in like the community.
So many similarities. So I find it like I love living here. I think we are really blessed with like beautiful coastlines, lovely cities, and to be able to have all that really pretty much on your doorstep, or it's not too far to go. And the people are great. I get on really well with the people. I think we've got similar kind of humour and probably wit, and probably a little bit more blunt. Irish people are really blunt, so I think maybe you get that. So there's a bit of a common understanding.
Yeah. So at what point then did you make the move back into academia and start thinking about starting a PhD, or what drove that?
I went back into practice when I came up here, and I kind of moved out frontline work, and I was a training coordinator. I got to work with public health teams. That was a huge influence as well, and work with kind of NHS providers. So I had like a whole range of people that maybe I'd never worked directly with, like city council members or public health experts, and I got to kind of see more than I'd ever seen before with all my other experience. And I kind of felt like when I started to do that work, which was more, with kind of wider teams and different professionals, it was time for me to change and move out of practice, that wasn't going to be where I would stay forever. I think I wanted to make changes, or I could see where changes needed, what I felt anyway, where changes could quite simply be made and improvements could be made for service users. And I said, I think I just said, right, okay, I'm going to go back. I actually did a continuous professional development, and a bit of a mouthful, in Newcastle, and that was received really well. And I actually got to talk to a lecturer from Northumbria and Newcastle, a member of research from Newcastle was there, and I just got chatting with them, and I said I'd really love to do a PhD, and they were like, do it. And I think they gave me the confidence to come back, do my master's, got a little bit of guidance from some kind of lecturers and researchers, told them what I wanted to do, and they said, just do it, just try it out, see how you get on. Came back, did a master's in public health and health research, and then applied for my PhD. So I finished that in September. PhD came up in December, I think it was somewhere around that. Dates are getting a little bit fuzzy, but I applied for my PhD with Ruth McGovern it was vulnerable families was the topic or the theme, and got it and started in January. So amazing. Really lucky, really.
I think it's really nice to see that, because I think when some people think about the kind of experience of working through STEM and staying in academia, that they think it's a linear progression, that you go from undergrad, master's, PhD, and that you kind of stay on track, when actually, and especially with research like yours within public health, that to take that time out to go and work on the front line in these with the service users and work with actual people, and then bring that back into research offers so much to the work that you do, to have that understanding of.
Completely. I don't think that I could do the research that I'm doing at the moment and the research that I did in my master's without having that informed kind of background and the networks and the connections. So I know different pathways, I know different services, I know I have a good idea around commissioning, and I think I'm able to bring that now into my research, and and help my colleagues as well, make suggestions, share networks. I think that's really important in a PhD as well. It's certainly in a public health PhD, to kind of be able to bring that little bit of experience. And I think it really did me the world of good.
Definitely. Well, that brings us to where you are now then, in the midst of your PhD, coming towards the end of it. And it also brings me to the bit I love in the podcast.
Okay.
So this is something we like to call our 60-second snapshot challenge, where I like to try and get you to summarise the entirety of what your PhD is in 60 seconds or less. The timer starts now.
So my PhD research is focused on the reproductive health and social care needs of women who use drugs. It's actually developed a little bit with consultation with my expert advisory group to more look at women's sexual well-being. There's two arms to it. I've done a qualitative systematic review looking at the lived experience of pregnancy, and the research, so the qualitative research is around reproductive health and their perspectives on that. Why is it important, I guess? I think it's important because of maybe what I've seen in practice around, family planning and reproductive health, and I think there's a real opportunity there to kind of, influence policy and practice and improve outcomes for women who use drugs. I think there's a lot of opportunity to kind of have us all come together and, have meaningful conversation and debate about it.
Brilliant. Well, I mean, I think you did that very successfully. That was like bang on 1 minute, which people tend not to be able to do. And it was very elegant the way that you were able to do that. It almost makes you think you've done that before. No?
No. I think my supervisor put me on the spot recently, a bit in the last few months, and said, what is your PhD actually about? And every time I said something, she's like, but is it actually about that? So you kind of...
at least you could play this back to them now.
Yeah.
Anyway, but it wouldn't be a very good research podcast if we only gave you 60 seconds. So we will deep dive into it a little bit further and have more of an in-depth conversation as to what the research is all about. So do you want to give us a little bit more of a summary that's not just 60 seconds, and then let's have more of a conversation?
So the research is focused on women who use drugs. They can use alcohol, but I think for me, predominantly I'm focused. I think it becomes quite broad if I look at alcohol as well. And it's on their reproductive health. So I guess, what do we mean by reproductive health? I'm interested in their kind of experiences of contraception, family planning, and I suppose their overall well-being, reproductive well-being as well. Is it something that is important to them? how do they feel about it? What do they do to kind of maintain good reproductive health? Or is it something that they've ever considered? And I suppose what kind of shaped the research, or certainly my proposal, was reflecting on women that I had met in practice. I'd met lots of women who had their children removed, and lots of women who had consecutive removal of their children. So many children. And I always remember the kind of trauma that the trauma of that for women. And I suppose I often wondered, and this was when I was in practice as well, did anybody ever have a conversation with that lady about planning, like maybe having a baby? Because, you know, every woman has a right, if they would like to have children. I often wondered if they'd ever had a conversation, maybe that looking at having a child when it's best for them. And I didn't really see that in practice, if I'm honest with you. I just feel there's a real opportunity to kind of explore that with women. And it's not about, saying that women can't have children. It's not about that at all. It's just about opening up conversations. You know, lots of people who are in drug and alcohol treatment feel comfortable to open up about a lot of their life experiences that they've had. And perhaps there is an opportunity there to kind of broaden that and maybe have conversations. You know, I can't remember ever having a conversation with somebody about if they would like to have children.
Yeah. So is it about giving women the right to choose and the
it's
ownership?
It's about giving them autonomy over their reproductive health as well. And who does have that autonomy within their relationships is also an interesting kind of thing to explore with them as well. And it's obviously, it's quite broad when we're talking about it now, but I think it's really important for this population. I think it should be about empowering them, empowering women to kind of, you know, make the choices at the time that's right for them. Yeah.
It's a really interesting one, because I think when you, from an outside perspective, when you think about the support that's offered to these vulnerable communities, that autonomy over reproductive health is something that necessarily might slip through the cracks and isn't something that is immediately going to be caught. So when you're talking about people having these conversations with women, is that when they're coming through like those support networks that you talked about? Yeah,
absolutely. So any of the support networks really, and I suppose a lot of the services are really disjointed, and kind of how do you navigate all these disjointed services if you're, you know, if you are in a situation where you're dependent on a substance, you know, you're trying to manage that and maybe get access to, you know, treatment, get access to, if you need to go on a script, you know, you've all these you've got to go to the job centre, or you've got to find housing, you have to go to housing support, and, you know, it's a really complex kind of thing to navigate through. And I think it's important to reflect on that as well, because I'm not sure if I could navigate through all these kind of pathways and systems and present here, there and everywhere, and maybe have caring responsibilities, or, you know,
and I imagine as well that just the toll it takes and how exhausting it must be to continually have the same conversation with a variety of different services that don't communicate with one another. Yeah, absolutely. So there's, you know, they might want to get some mental health support, but mental health won't talk to them until they sort out their maybe drug use, and vice versa. And there is a lot of kind of a battle, and, you know, there are not a lot of services are talking to each other, or maybe doing more integrated kind of work, which I think is something that hopefully we'll see in the future as we move forward, instead of everybody kind of working in silos. And, you know, I think that it really is more of a comprehensive wraparound care that's maybe needed for vulnerable populations, instead of fixing one thing at a time. Not even fixing or supporting with one thing while something else is falling apart. I think it's a much more comprehensive kind of approach that's needed. So is that the hope for research like yours and research that other people do in this kind of area to, I suppose, almost create like policy change, or try to support services to improve their offering? Or I think that a lot of myself and my colleagues' work is about maybe evidencing where the problems are and kind of finding the nuances in those. And then, you know,
we do like work with stakeholders. We invite them to events. I've got a policy and practice partner on my systematic review, and she's a treatment governance director. And, you know, engaging with them in research, having them involved in research, and then using that to kind of implement or influence policy and practice, you know, and public health. But often the case is that we need to kind of evidence where the kind of, you know, the holes within policy and practice are, or, you know, outlining the lived experience and really making sure that it comes from those with lived experience, so that, you know, people from higher up aren't just kind of making policy pathways without kind of having the individuals with the lived experience of these pathways or services being involved. So I think that's really important within kind of our research.
Well, you mentioned earlier that you have an advisory group of the kind of women that are experiencing or have the lived experience of what you're looking into. Do you want to tell us a little bit about what that means, what it means to have an advisory group and how they support you as a researcher?
So I have an expert advisory group. There's a lot of encouragement within research now to have patient-public involvement, and I absolutely agree with that. I think it's fantastic. I have a lovely group of 5 women who all have lived experience. They're not affiliated with any support service per se. It's very much a peer network that they set up over lockdown, so quite new, but they have, it is a peer network, and they kind of all know each other through this peer network, and they all have lived experience. And what they've done is they've come in, we've chatted about the project, and they've really helped me develop the project. For example, I think originally it was around reproductive health. They felt really uncomfortable. I wouldn't say uncomfortable, but they disagreed with that term, and they felt like, yeah, if you ask about reproductive health, you're just going to ask me, am I on the pill? Or something like that. Whereas they felt, actually what you're saying to me, Claire, is that we're talking about women's sexual well-being. So that really shifted the kind of the research, and, you know, to think about how we kind of phrase and word things, because they felt reproductive health was too health focused, say, or was just too maybe long-winded, or didn't fit what their understanding perspectives. So they helped with topic guides, you know, making sure that it was accessible, that the language was okay, that the questions were suitable, that they didn't feel uncomfortable with like the questions, because it can be a very personal thing. And yeah, they're going to stay and continue. They're going to help with recruitment. Hopefully we're going to get a paper written up together. We're going to do a workshop, and this is all of their first time being involved in research. They've never been involved in research before. I think one had been involved in an interview for a PhD project, but it's a really exciting experience for us all. And it's a real privilege to have them involved, because that is going to shape the research, and, you know, it's just a wonderful thing to have them involved.
Yeah, I think it's like, it's not something that some researchers are aware of yet, or have had the opportunity to acknowledge yet, how impactful just simple things like changing the language around how you talk about things, and how much of a difference that can make to your studies, to make people feel welcomed and included, and I suppose seen as part of what it is that you're doing, that and providing people a voice at the table to be able to have that conversation with you is not a difficult thing to do in the grand scheme of things, to invite someone into a space, but can have such wild impact on the work that you're doing, to improve the work that you're doing.
Yeah, and I think around the word, and I think maybe for me, I might have thought, having come from a practice background, that I would have considered everything and kind of understand the needs of this population. So it was great for me, because it was a learning curve as well, you know, to have them involved and say, actually, no, Claire, don't like that. But they said, can we do a question around like what you thought of when you were younger to now, so you get like a retrospective. That was like these are fab ideas that I wouldn't have considered, but having their voices within, you know, and their involvement means that the research is going to be far better than it would have been if they weren't involved. And it's exciting. It's exciting for us all.
And how does it feel for you as a researcher to kind of share this space with people who are going to be directly impacted by the kind of work that you do? Because we talked about it a little bit earlier, but a lot of research feels so disjointed from the people that it's there to support. And there's a phrase that goes around with public involvement, which is nothing done for us without us. But so much research is done without the people that it aims to impact. But what's it like to have people there to I suppose, keep you focused, keep you on, I don't know what the words I'm looking for, keep you aware of that lived experience, I suppose, and always having that in the back of your mind while you're doing the research?
I think it's an absolute privilege, if I'm honest, to have the expert advisor group, the women involved in the project, because I need them to be involved. They just provide so much insight into with their lived experience. It's invaluable, and it's really important. And I just don't think that without having the expert advisory group, I just don't think the research would be as meaningful.
No, definitely.
And it really strengthens, the wider impact, and also for dissemination as well. I think they want to be involved in some of the dissemination activities, and that's exciting as well because we kind of come as a package now. Well,
that was going to be my next question, really, because I think not just when we talk about the impacts of inviting people into the space when we're doing research, we a lot of the times talk about the impacts it has on the research and the impact it has on the impact of what you can do. But and obviously I can't speak for the women that you work with, but a lot of the times when we have people involved in projects, having that ownership over research or seeing their name when a research article is published, becoming a published writer, or having that ownership over something that's being created is really powerful for the people that can be brought on board as part of research as well.
I hope so. They are really keen to be involved. But if I'm honest with you, it's kind of a difficult balance. You're trying to balance out not being overburdensome. You really want their involvement and they want to be involved. So there's a lot of balancing and I suppose communication, and also, making your expert advisor group aware that, they're free to kind of dip in and out of where they feel comfortable. And it's not a kind of formal commitment for the next however long. And, I think as well, be mindful that, other people have different responsibilities. A lot of the women have care and responsibilities, careers, other things that happen, that go on in life. So being mindful about that as well and considerate, I think you'll work well together.
Yeah, because you're almost creating a relationship with people, aren't you? Yeah. It's getting away from seeing people being brought on as almost like a tool for your research, but that it's the symbiotic relationship of having them on board, that it's you're creating an established relationship with them.
Yeah, and rapport building is really important. And, being able to kind of have conversations, it can't be too formal with PPI.
Yeah.
It's not a formal relationship. It's more of a kind of, you've got to build rapport with individuals and, and they are colleagues essentially.
Yeah, exactly.
So it's about maintaining that respect and understanding and, being aware of, as I said, wider commitments that people have. And for us in academia, we can kind of say, right, we need X, Y and Z done on this date, but it doesn't really work like that for everybody else. And, be mindful about that as well and consider their other kind of responsibilities. And this project is just, is something that they're a part of and they want to be a part of, but, we all have lives outside of work.
Yeah. Amazing. I mean, I feel like I could talk to you for hours about the stuff that you do, because I think it's really inspiring and I think it's really refreshing to see this approach to research, which should be the more common than it is. And it's really nice to kind of get involved in that conversation. But there's a podcast that needs to end at some point, so we'll start to draw that to a close. So I have one more question for you, which I ask to all of the researchers that come on the podcast here, which is, why do you research?
I research because I would like to be a part of change that improves vulnerable populations' lives.
Thank you so much for joining us on the podcast today.
Thank you for having me.
You've been listening to Why I Research. Make sure to follow us on Twitter at YIResearchNCL and subscribe so you don't miss any future episodes.